Introduce yourself and verify the client's identity. Explain the procedure to the client, provide privacy. So this is to gain cooperation and lessen the anxiety of the client. And then, perform hand hygiene and observe appropriate infection control. So this is to minimize the contamination. And then, we have to compare bilaterally during assessments. So this is for the baseline assessment. So for the muscle, inspect the muscle for size. Compare the muscles on the one side of the body and to the same muscle on the other side. Inspect the muscles and tendons for contractures. And then, to test the muscle strength, compare the right side with the left side. So for the sternocleidomastoid, client turns the head to one side against the resistance of your hand and repeat with the other side. And then, for trapezius, client shrugs the shoulder against the resistance of your hands. And then for deltoid, client holds arm up and resist while you try to push it down. And then for biceps, client fully extends each arm and tries to flex it while you attempt to hold arms in extension. For triceps, client flexes each arm and then tries to extend it against your attempt to keep arm in flexion. So for the wrist and finger muscles, client spread the fingers and resist as you attempt to push the fingers together. For the grip strength, client grabs your index and middle finger while you try to pull the fingers out. So for the hip muscles, client is supine, both legs extended, and client raises one leg at a time while you attempt to hold it down. And for the hip abduction, client is supine, both legs extended. Place your hands on the lateral surface of each knee. Client spreads the legs apart against your resistance. So for the hip abduction, client is in same position as for hip abduction. Place your hands between the knees and clients bring the legs together against your resistance. So for the hamstrings, client is supine, both knees bent. Client resists while you attempt to straighten the legs. So for quadriceps, client is supine, knee partially extended, client resist while you attempt to flex the knee. So for the muscles of the ankles and feet, client resist while you attempt to dorsiflex the foot and again resist while you attempt to flex the foot. So for the range of motion, test active ROM by asking the client to do joint movement from head to toe. So this is to determine the patient's mobility status and to compare and evaluate whether a loss in joint mobility has occurred as a result of clinical changes or treatment. So for the neck, ask the client to move the head down towards the chin and up, move head from side to side, to bend laterally, and rotate head. So for the arms and shoulders, ask the client to move his arm up and down, to raise his arms forward, to bring his arms as far back as possible, and to bring his arms towards and away from. So for the elbows, ask the client to bend his elbows forward and downward and to move his elbows from side to side. So for the wrist, ask the client to move his wrist up and down and from side to side. For the hands and fingers, ask the client to make a fist and to close and open it, to spread his fingers out, and to bend each finger individually. So for the trunk, ask the client to bend towards his toes and to bend backwards, to bend from side to side. So for the hip and knees, ask the client to move each leg forward and backward, to move leg from side to side, and to rotate each leg. Ask the client to bend each knee. So for the ankles and feet, ask the client to point his toes up and down, to move his feet from side to side, and to spread the toes of each foot apart. So for the deep tendons reflexes, have the client relax, provide support for the extremity to be tested. So this is to provide client's comfort. So for the biceps, place your right thumb on the client's right biceps tendon with the client's arm slightly flexed. So strike your thumb with the pointed end of the hammerhead and strike with the least amount of pressure. So for the triceps tendon, have the client hang his arm freely, support the arm with your non-dominant hand, with the elbow flexed, strike the elbow directly with the pointed end of the hammer. So for the brachioradialis tendon, strike the forearms with the hammer about 1 above the wrist over the radius. So for the quadriceps reflex, have the client sit with his legs hanging and then strike the tendon just below the patella. For the Achilles reflex, support the foot in dorsiflex position and then tap the Achilles tendon with the hammer. So for plantar reflex, stroke the sole of the client's foot with a flat object. It may be absent in adult without pathology or overridden by voluntarily control. Document findings in the client record using forms or checklists supplemented by the narrative notes when appropriate. So this is for the future evaluation, and then report deviations from expected or normal findings to the primary care provider.